Our vision for the future is the perfect emergency room. When a patient comes to the emergency, they sign in at registration, have a seat in the waiting room, and are called to triage by severity, based solely on the chief complaint that they put down in registration. This can take a long time. In the future, patients will sign in on their smartphones as they walk into the ER. Their vital signs will be entered automatically by a machine at the door. This will help the triage RN determine which patients need to be seen first. When doing med recs, patients either don't know which medications they're on, or there's simply just too many to recall. In the future, patients will wear an identifying bracelet that syncs with any pharmacy where a prescription has been filled, and the list of meds will automatically be uploaded to the hospital system. When a patient needs to go to the restroom, the RN needs to put them on a bedpan, give them a urinal, or assist them to the restroom with all the equipment attached. In the future, the patient will push a restroom button and an automated transport will come and take them to the bathroom. There will also be trap doors on the stretcher that open and allow the patient to go without getting up. Patients can be fitted with undergarments that attach to a suction system that can collect body fluids that we can send to the labs. When the patient is discharged, sometimes it's hard to get the printer to print properly, or hard to find which printer your paperwork was actually sent to. In the future, there will be a tiny energy-efficient printer in every room where discharge paperwork will automatically print out when the doctor signs the orders, or the patients will have the option of getting it on their smartphone or tablet. When the patient gets prescribed new meds, they get paper scripts and you're never sure if they'll be able to get these prescriptions filled. In the future, the ER will have two pharmacists, one that will help medicate the patient during their treatment in the ER, the second will fill the patient's prescriptions and deliver them to the room just before the patient leaves. On discharge, the removal of the IV catheter can be painful as the tape pulls the hair out and the patient has to stay a while so we can monitor the site for bleeding. In the future, a special skin-safe solution will be applied to the tape and Tegaderm that will quickly and painlessly remove anything adhering the INT to the skin. A special antimicrobial gauze that aids in clotting will be applied to the site, eliminating need for monitoring. Once the patient has left the room, a janitor needs to be called to clean the room before another patient can be admitted there. This can increase wait times for new patients. In the future, when the patient leaves, the door will seal and a fine antimicrobial mist will spray and coat the surfaces of the room, including monitors, beds, tables, IV pumps, etc. This process will take 3 minutes and will kill every bacteria and virus. Most importantly, the perfect ER room would be used only for emergencies.
Created using Powtoon.